Hey everybody, Dr. Angie here. I wanted to make a quick video about thyroid labs and what you should be asking your doctor for. So thyroid labs can be simple to complex. So the first thing that most doctors run is something called a TSH. So TSH stands for thyroid stimulating hormone. That's the hormone that goes from your brain to your thyroid to tell it to produce hormone. It's a very cheap test. Most doctors run it. Most insurances cover it. Whenever I ask people if they had their thyroid labs done, they say yes, and that's generally what has been run, is just a TSH. Normal is somewhere between 0.5 and 4.5 on labs, but optimal is between 1 and 2. So you can check your labs on that. The next thing that we want to run is if you want to run a little bit deeper thyroid panel, you're looking at things like free T4, which is your inactive hormone. That's what your thyroid produces. And then you want to look at free T3, that's the active hormone, and that you actually have to convert the T4 to the T3. These are a little bit more extensive tests, and insurance doesn't always cover it. I haven't really ran into that issue, but I always run it on my patients because really TSH is only one piece of the puzzle. So I always run a TSH with your free T3 and your free T4. And then one last one that I always run, it's in my thyroid panel, is a TPO antibody. And that is screening for Hashimoto's and other thyroid autoimmune conditions. So make sure that you ask your doctor for those. I'm going to give a quick story about why I'm doing this today. I had a patient come in and she has Hashimoto's thyroiditis. She's been struggling with it for a while. And she does see an endocrinologist for this. And when she came into me, she brought her labs. And I was a little bit perplexed at what they had run because they only did a TSH and a free T4. And then they were giving her Synthroid, which is synthetic T4, the inactive hormone. So I asked her what her antibodies were, and she told me she didn't know. I asked her if they had ever ran the antibodies, and she said she thought they had, but wasn't really sure when the last time they did it was. So we ran more labs, and I ran her TSH, her T4, and her T3, both of them free. And then I ran her TPO antibodies. And lo and behold, her TPO antibodies were over 600. It was so high that they didn't even give me a value. They just said greater than 600. And then her T3 was really low. So long story short, I had been seeing her for a little while. And then her endocrinologist actually ran her labs recently. But they, again, only did TSH and free T4. So her TSH was really high, meaning that the brain wasn't getting the signal to shut off stimulating the thyroid. So that increases your TSH. It means that you likely have hypothyroidism. So her TSH went up really, really high. And then her T4 was kind of like borderline middle of the range low. So what did he do? He increased her Synthroid. But when I ran the labs, I found out that her T3 was low. So that means that the brain was not getting the signal to shut off because it wasn't making the right hormone, the T3, the active thyroid hormone. And so because I ran that, I was able to give her some free T3 hormone in the form of Cytomel. And I think she's going to feel a lot better. She's going to have more energy, and hopefully that takes care of some of the other issues. We are working on her TPO antibodies, bringing those down using peptides. But to recap, just make sure that when your doctors are running thyroid hormones, make sure that you're asking for 4 things. Okay, so TSH, that's the brain chemical going down to your thyroid to stimulate it. Free T4, that's your inactive hormone. That's what your thyroid produces initially. Free T3, that's the active hormone. And then a TPO antibody. I hope this helps. Have a great day.